Good afternoon, everyone. Thank you for joining us for our monthly training this afternoon. We are very pleased to have a wonderful speaker and some co-presenters that he has lined up. But before we get started, just a little bit of housekeeping. Please make sure you keep your devices muted. There will be time at the end to ask questions to our presenters. If you have questions, feel free to put them in the chat. We encourage a very collaborative environment, so we'll allow you to come off mute and ask your questions directly to our presenter. Also, just to note that we do have closed captioning available as well, so you can enable that from your menu on Zoom. And let's see, again, this is our part of our monthly training series. Our next installment of this series will actually be on a Wednesday coming up in June. So that'll be June 15th. I'll talk a little bit more about that as we wrap up, but I want to make you all aware that next month's training will be on a Wednesday instead of a Thursday. I know that's a little different from our usual rhythm, but that will be the change that is taking place. So without further delay, I'm going to turn it over to our speaker. He will introduce himself. And I'm excited because technology obviously is a big part of everything that is happening in our world today. So James Puccioni will take command of the slides. I will stop sharing my screen. And James, I will let you take it away.
All right, thanks very much, Karan. I'm just going to get my slides up. And while I'm doing so, I want to thank everybody for joining and also thank my co-presenters in the room. I will call the more of the actual experts than I am, but we're lucky in Massachusetts to have a lot of partners doing a lot of great work on technology access and digital equity, one of which is Tony Schloss from the Metropolitan Area Planning Council. I'll let him introduce himself once we dig into his slides, and also Cynthia Wilkerson, who's going to join in a few minutes from an organization called Little Brothers Friends of the Elderly in Boston that has a great digital access training program called Digital Dividends. But I want to thank Trust for America's Health. I want to thank everybody for joining. So I'm James Puccioni from the Massachusetts Healthy Aging Collaborative. We are funded by a regional health plan foundation called Point 32 Health Foundation, which was formerly Harvard Pilgrim Healthcare and Tufts Health Plan Foundation. Our goal, our mission, the centerpiece of what we do is to promote and support inclusive age and dementia-friendly communities. And as I'm going to talk about in my slides, technology in the past couple of years has become a central part of that. We've been spending an increasing amount of time in advocacy and in working with a number of partners because there's just so much going on and so much attention policy-wise, funding-wise on a state and federal level. So we've been lucky to build a cross-sector network and get the voice of older adults embedded in a lot of the work that's going on. So I'll just talk about the MHAC network, Mass Healthy Aging Collaborative Network. We are a statewide cross-sector network of state agencies, state government agencies, local communities, regional entities. I mentioned the Metropolitan Area Planning Council, regional planning agency is one example of that. We have a lot of community-based organizations and expertise in different areas of, what communities care about. When we talk about healthy aging, we talk about age and dementia friendly. That includes housing and transportation. And as I mentioned, increasingly so on technology. But our strength is in our broad, diverse network that gets together periodically to talk about funding opportunities, policy opportunities, different practices that could be scaled and replicated. And through that, we're able to be sort of these master dot connectors, and it's been called age-friendly speed dating, but we end up, connecting a lot of people that end up doing amazing things through great partnerships. And we're just lucky to be in a position to be able to do that with a sort of wide angle lens on what communities or what matters to communities and being able to listen to communities as well. So beginning with, and everybody here probably knows all of this, but just in setting up technology in the work of age and dementia friendly and in social determinants of health, Going back to what the World Health Organization set out as some of the highlights of what age-friendly environments are, which are accessible, equitable, inclusive, safe, and secure and supportive, and that older people play a crucial role in their communities. And if you think about technology as part of this, it can really address a lot of these check marks, or it could sort of exacerbate existing inequities. And so what we're trying to do is the former, to help address a lot of these issues, to make sure communities are accessible, equitable, and so on. So another thing you might be familiar with is the 8 domains of an age-friendly community. There's lots of different frameworks for age and dementia-friendly work out there, but because we had in Massachusetts such a strong dementia-friendly community statewide initiative, it was a little confusing to communities to say age-friendly communities, dementia-friendly communities. We now have age-friendly public health systems, age-friendly health systems on a hospital and health system level. So we tried to mush everything together. We took the 8 domains of age-friendly, 11 sectors of dementia-friendly, and so on, and put them into sort of a custom framework, which we still promote as a menu of options that communities kind of can address and choose from different issue areas based off of community feedback. But what we highlighted is that we added technology in the past couple of years based on the work that we've been doing. It's tucked under communication information on this framework, but technology really kind of goes throughout all of these things. And so all of the these different buckets and focus areas you see here have been funneled into an age and dementia-friendly integration toolkit. So this is on our state's Executive Office of Elder Affairs website. And so we have all kinds of resources and different practices under all of these different issue areas, and technology is now included. So things that are both age and dementia friendly are kind of noted if you go to this resource and click under there. But this was set up initially as something to help communities be both age and dementia friendly. And now we can infuse technology as part of that work. One thing that we're really lucky to have, thanks to Point 32 Health Foundation supporting UMass Boston in doing this work, is our Healthy Aging Data Report, which is now a few years old, but does have a community profile on all 351 of our cities and towns in Massachusetts. And so I get to go around taking credit for the great research and work that UMass Boston has put together, and show communities that they have a data set and a place to start the conversation about how to be age and dementia friendly. And part of that is the percentage of older adults, you can see in the bottom right-hand corner, who used internet in the last month. Again, a lot of these numbers have all changed in the past couple of years, but it still gives communities a starting point on a very local level on how to start this conversation about technology access. So getting to what everybody's familiar with in social determinants of health, I guess we could have named this session around something else, because technology is certainly a social determinant of health. But when you look at, this graphic that a lot of folks are familiar with, technology really ends up being a cross-cutting theme that overlaps pretty much all social determinants of health in some way, shape, or form, and can improve or exacerbate, as I said, access and inclusion in a number of different things. Access to information, most notably, but also in filling out government forms. We think about civic engagement in Massachusetts. A lot of public meetings and advocacy can be done online and virtually, as can most everything else right now, including this meeting. So having access to that, just virtual opportunities in general, is such a broad category of things. So it's really more than just a social determinant. It's really cross-cutting. So this is a little difficult to see, and I'll explain it. But in the journal Nature, they advanced this idea that technology is a sort of an overlapping, cross-cutting theme across social determinants of health. So when they put digital literacy and access in the middle, they kind of reworked that social determinants graphic with just how it touches these different categories: access to food, to education, to neighborhood and physical environment, and economic sustainability, and so on and so forth. I will say, with older adults, you know, what we've experienced in Massachusetts, and I'm sure others have too, is what, you know, when you think of technology in older adults, a lot of people immediately jump to telehealth and, you know, telehealth visits. But that's the same issue we had with transportation. And so when we thought about transportation before, you know, it was rides to medical appointments, as if that's the only place that older adults go. Older adults want to go everywhere in the community and do things that are meaningful to, you know, that they find meaning in, that help them engage socially, and so on and so forth. And technology is very much the same. So people find different sets of values from being online and having online opportunities. So the one thing that we would add to the middle of this, besides digital literacy and access to devices and broadband, is also awareness of what you can do with technology and how technology can serve folks, and also awareness in keeping people safe online, just being aware of scams and fraud and that kind of thing. So so that's one thing that we would add to this graphic. And during the pandemic, we were part, you know, we supported a study on how innovative community responses to COVID supported healthy aging. And the technology related elements of that report, you know, should be no surprise that older adults disproportionately impacted by the pandemic include those with limited access or proficiency with technology. In communities focusing their, you know, their responsive efforts, whether it was with food, medicine, you know, seen as a primary or secondary response with mobility and well-being and other conditions, technology was a part of all of the responses. And so older adults and their families who had access to technology were able to seek out a wider array of information, services, and social connections more quickly. But it was a two-way street, and organizations and state agencies and even, you know, local government that were trying to reach people could more easily do so with people that had access to technology, whereas a lack of technology was a significant barrier. So this is just one example of how technology, access to or lack thereof, affected everything in pandemic response. One of the partners we work with is the Essex County Community Foundation. They're among the first to kind of include older adults as part of you know, the digital access and digital equity discussion. And so you can see it's kind of blurry, and I apologize for that, but internet use among older adults in the county is highly variable. You have a low of 62% in the city of Peabody, up to 78 in the town of North Andover. And, you know, a lot of pandemic response with technology focused on kids. And we even have a state commission on broadband access, and it was focused on students and families. And one of the things we were able to do was stand up and raise our hand and say, well, older adults are part of families too, so we should be talking about digital access and older adults. But luckily, Essex County was one that you know, was already talking about this, like I said. And so they noted that stigma sometimes limits efforts to help seniors, but telehealth, as I mentioned, is just one area where digital access could be transformative. So again, getting to the idea, if you're familiar with reframing aging or just familiar with addressing ageism in general, you know, that older adults do not want to learn technology or do not want to adopt technology, or it's not a useful, you know, it's not worthwhile to do. but we have plenty of partners, and two of them are going to just share in a few moments about how we need to be including older adults as part of this. So on our website, what we've been doing is collecting digital equity resources, everything we've been using for advocacy on a state and local level, on a regional level, how we approach digital equity in older adults, research, reports, funding opportunities, everything that kind of crosses our path, we're able to put on this website for our age and dementia-friendly communities, our partners, stakeholders, and our statewide network. All kind of gets funneled and channeled on this website. So feel free to check out any of this stuff. There's a lot of national reports as well as state-specific ones. One report that's another region of Massachusetts is what we refer to as the Pioneer Valley. So we tend not to do things by county in Massachusetts. Every region has an interesting name. So Pioneer Valley is Hamden, Hampshire, and Franklin counties in Massachusetts. So there's a regional collaborative called the Alliance for Digital Equity, and they did an amazing job at uncovering a lot of programs that provided devices, broadband access, skill building, all three in many cases, to older adults, and some of the challenges being faced. So just you see a few examples on the left and just a few quotes from the listening sessions and the community engagement on the right. But to state the obvious, the programs that address providing devices, broadband access, and skill building all at the same time are usually the most successful ones. But there's all kinds of examples in this report, which I didn't put a link to in the slide, but I'm happy to share with anybody interested, because there's a lot of great local data and a lot of great sort of themes that came out of the fact finding from this report. So that gets to our advocacy approach and how we work to address this through communities and through our statewide engagement. So any approach to addressing digital equity, we say, should not only consider older adults, but all sectors of the community. So in other words, what we're saying with this is you can't just address councils on aging or senior housing or any one sector of a community and say that older adults are fully engaged. Only through we feel like placing an age-friendly lens on this work in all parts of the community, whether you're working with municipalities, with libraries, with regional governments, with whomever it is, kind of considering older adults throughout all approaches is the way to address digital equity for people of all ages, especially older adults. And recognizing that older adults live in a variety of residential settings. Many live in intergenerational households. Many are responsible for raising grandchildren or care for their adult children. And these are all just considerations. I mentioned already awareness and education around fraud and scams as more older adults get online, the awareness of how to be safe and protect your personal information. Skill building policies and programs can be flexible and use existing community assets. We have a great state association of all of our community libraries that lend out Wi-Fi hotspots to anybody in the community. So we've been able to partner up our libraries with councils on aging, with senior housing, with different folks to say, this isn't every leg of the stool on digital equity, but certainly being able to loan out a hotspot from your local library is a great asset in the community to have. And we've seen a lot of pairings between schools and councils on aging to provide tech training or tech office hours, or just kind of, phone call assistance or in-person assistance in many cases too. And then going back to the reframing aging part of this, this whole equation, that many older adults are proficient users of technology and themselves can serve as a resource to their peers. So just like with just reframing aging in general. We talk about older adults as assets that strengthen communities, that transfer knowledge, wisdom, experience to everyone to make communities better. The same can be said with technology, that you have older adults that may be retired engineers or have had a career in working with technology anyway, and can really do a great job of understanding the needs of kind of people in their own age group about how to access technology. So, and the bottom line through all of this and all of these points and more is that if we can support partnerships and collaboration between all of these sort of community-based entities, faith communities, community-based organizations, local government, healthcare, and so on, we can address all of these things. And while there's a lot of funding and attention going to physical infrastructure and increasing broadband, as there absolutely should be, there's something to be said for the social infrastructure part of this as well, and that bringing different partners together can break down and make more efficient just all of the things that we're can break down silos and make more efficient the things that we're all trying to do in general, which is just to get everybody to row in the same direction when it comes to helping and supporting older adults. And we think it can be done for digital equity too, and we're seeing it happen. So I just wanted to share a few examples before we get to our amazing co-presenters. One is the Mass Association for the Blind and Visually Impaired, that even before the pandemic launched a tech access training program to provide instruction for people who are blind and visually impaired. It provides open access to printed and digital information for whatever people need. So it really works with, I think the key is here, before getting into the actual skill building, it asks sort of what's important to people, whether that's transportation, healthcare information, social connection, and then it builds the training around what the person needs and what their kind of goals are. So through that, this individual lessons participants use to learn technology to meet their own goals and needs. Clients can bring their own technology. But you see the quote at the bottom that really says everything, that with technology, I'm not afraid to be alone because I have access to the outside world. So all of the amazing things that you might have on your iPhone, screen readers, all these things that are available to people who are blind and visually impaired, are able to be kind of connected through this program that's going statewide. Another organization, AgeSpan, an aging service access point and elder services organization in Northeast Massachusetts, has a digital access program that actually has people that work at the organization that go to people's homes, fully masked up, socially distanced, however people are comfortable with doing this. It provides a data plan with a device that is good for 6 months or a year, and if participants need a data plan, the organization will pay for those for up to 1 year. If after 6 months participants using the tablet engage successfully online, it becomes theirs at no cost. So again, a lot of this turns into just being able to be connected to whatever people feel is important in their lives. And in this case, we have a quote from somebody, it was actually from a program manager, that talks about when somebody got an older adult got their tablet, he was able to FaceTime and connect with his family. Before that, he wasn't able to see his grandchildren, and he utilized the tablet for connecting with his grandchildren on Zoom. And he says it's the best thing that happened to him in a while, and he doesn't have to feel alone anymore. So, through all the social determinants and through all the discussion we have on social isolation and loneliness, technology is just an amazing way to address that, and a number of other things. And then just quickly going down the line, partnerships between schools and councils on aging, kind of having students volunteer to support older adults. The villages of the Berkshires, so one of the village to village networks, work with Berkshire Community College students as volunteers providing socially distant services as tech support and wellness calls until face-to-face services could safely expand. And for our own part at the Healthy Aging Collaborative, we've been able to be a little bit sneaky with some funding opportunities that came from the state, and traditionally went to things, technology needs of cities and towns. But we were able to rework and repackage some of those funding opportunities for age-friendly purposes that led to a downtown Wi-Fi network in the city of Pittsfield. And that conversation started with, through using the state funding to see if we could have a Wi-Fi public park between a council on aging, a YMCA, and a church, some green space that was shared. It ended up being an entire downtown Wi-Fi network, which ends up supporting everybody. It's more than we intended to do, but we're very excited to see that come to fruition. And then other communities have used the state funding opportunity for loaning out devices and tech education programs and so on and so forth. So through all of this and through a view of technology as a sort of a cross-cutting social determinant of health, it really helps frame up our advocacy and how we approach this as an organization and how we work with different partners and how we can highlight what different partners are doing and the great progress different partners are making. So again, this is just a picture of downtown Pittsfield for no particular reason, and a news article on how they got state funding for their public Wi-Fi network. And so, we're just trying to take every opportunity we can to move the ball forward and work with some great partners. And so now, with all of that I just shared, I want to turn things over to Tony. If you're out there, I can advance your slides if you want to say next.
Great.
You out there, so you can introduce yourself. And Tony, thanks again for joining and doing this.
Thank you, James. Hello, everybody. I've been on a lot of calls with James throughout this digital equity work that I've been doing, and he's been super helpful. He's a fierce advocate for older adults as it relates to technology, and I'm sure lots of other stuff. So if you need support, in addition, you can always reach out to me, but I encourage you to reach out to James. My name is Tony Schloss. I'm a civic technologist, which means to me, I am sort of the middleman, the middle person between the tech people and citizens. And people. And I like to translate that work. And what I mostly like to do is make sure that the tech that's being built is informed by community members, it's responsive to community members, and it reflects those community members as well. I was actually, some of the things James mentioned had me reflecting. I was actually launched into this career because we had built a public Wi-Fi network in Brooklyn, and when Hurricane Sandy came, it wiped out all of the communication networks except our little Wi-Fi network. And so all the residents of public housing here in our neighborhood were able to reach their loved ones, find resources because of our work. And so this community network showed, as I said, it reflected the community, and it was that, as James was mentioning, the COVID response. It's like it allowed the community to have tools to respond to emergencies. My children are coming home from school, so I apologize if I missed this, but James mentioned the 3 legs of the stool of digital equity. And I just wanted to say, in case others were wondering what that meant, and I apologize if you said this, James, but those 3 legs of the stool, as we understand it, is access to the internet, digital literacy, so you know how to use your computer, your device to find the resources and be engaged civically, and then having a device. And so when you all are thinking about ways that you want to serve your constituency in terms of technology or digital literacy or digital equity or access, this is the 3 legs of the stool is a great framing device for that. So I work now at the Metropolitan Area Planning Council, and we are a regional planning agency for the cities and towns within the sort of greater Boston area. And as you can see, we do a lot of different stuff, and a lot somewhat spurred on by the pandemic, we've brought on digital access work into our portfolio of work. as I present the work we're doing, I think maybe the framing for all of you would be, these are things that you could work with your own regional planning agency in your area to do, because they can, the regional planning groups that are all throughout Massachusetts have the best relationships with municipalities, and they can help you to, navigate that work. So I'll tell you a few of the projects that we've been doing here. James, if you'll go to the next. We're doing a lot, as you can see. I won't bother. The blue ones are like sort of our projects that are going on. We do digital navigators, which we help support the launch of some digital navigators in our communities. British Broadband is a connection between school systems and municipalities to help identify who's in need. We're building, we do regional convenings, which you can all are welcome to join. All sorts of things. But today I want to talk about the 3 boxes at the top. So we're going to talk about our digital equity plans, our Gateway City Wi-Fi deployments, and our equity plan and access and sort of a community network plan for Urban Edge, which is an affordable housing developer. So we can, thank you. So a digital access and equity plan, we did this for Everett, Chelsea, and Revere. And in many cities and towns, actually, to qualify for incoming federal aid, which there's a lot, which we won't get into because there's a whole nother ball of wax. But in order to get that federal aid, cities and towns are going to have to create these plans. And so we happen to be ahead of the game, and we made these plans for Chelsea, Everett, and Revere. And if you have a plan like this, and I'll explain to you how we did it quickly, hopefully, then that helps the town to decide how they're going to invest their capital, the policy decisions they're going to make, and then the program needs that they can fund or create. Please, next, James. Thank you. What we did, and this you could do a lighter touch on your digital equity plan, but this is sort of the full package. Is what we did is we did existing conditions analysis. So we look at census data and other data to figure out what's happening in our communities. Then we go a little bit deeper and we do surveys. In this case, we interviewed about or had about 2,000, more than 2,000 residents of these communities respond about what they're seeing and their online access and their digital literacy and their career training, goals. Then we do an evaluation of the infrastructure and the technology, like where is the fiber optic cable? And without going again into that too deeply, everyone should insist that their cities have fiber optic cables everywhere, because for the next 50 to 100 years, fiber optic cable is going to provide the connectivity and the speed and the resiliency that's going to be required as we continue to grow all of the devices and the smart city applications that are required as we move forward. And lastly, then we make recommendations of how policies to make, investments to make, et cetera, et cetera. Thank you, Jane. And we do a lot of work in the surveys, and this is just a quick example of, we ask people if you have internet access, and they tell us, and we find out what it is. And it turns out in these communities, about 30% of individuals do not. And we ask why, and it's across the board. As you can see here, it's a little hard to see, but 77% say because it's too expensive. So thank you. And we go on, and what if you could find a career in technology if there was training, workforce development? Many people are very interested in that. Everybody sees that as the future. So those are the components of a digital equity plan that you might ask your municipality to investigate. Thanks, James. Then we had another opportunity through the Massachusetts Broadband Institute, which is the organization that oversees all of the sort of I'm very much focused on broadband, if you haven't noticed, like connectivity. Massachusetts Broadband Institute is the group that handles all the funding across the state to do this type of work. And so we were working with them to build public Wi-Fi networks, and a little bit more. That work has expanded. So I'll tell you about those really quickly. Next slide, please. Much of the digital divide is actually concentrated, especially in urban areas, in multi-dwelling units, in housing authorities, in apartment buildings. You can see in Massachusetts, there are 225,000 households who don't have an internet subscription. A great large amount of them are actually concentrated in multi-dwelling units in apartment housing. So housing authorities was our target. And we thought, and we selected 3. We're still working through this process, 1 in Chelsea, 1 in Everett. And Everett is actually a senior and disabled housing. And then we have another site in Revere. So what we'll do is we're going to bring a big high-speed connection, a fiber optic cable in this case, to these sites. And then we're going to spread it out throughout the buildings using Wi-Fi access points. And what's interesting about that is it is somewhat efficient because, and to conceptualize this, we're talking about an airport Wi-Fi essentially, or hotel Wi-Fi where you're in there and anybody can get on. And we can do it this way and we can do it more quickly because we don't have to go into resident apartments. We can put the access points in the lobbies and what have you. I had a slide in here I wish I had kept in here because we did a survey. It was a small survey, but we did a survey in Everett with the older adults there. And about half of them did not have internet. And most of that half were because it was unaffordable. But then some also said they didn't know how to get it. So as James makes a good point, we have to think holistically about this, but we have to make sure we have some focus on the older adults in our community as well. Next slide, please. This is how you do it. You walk around the apartments. You have special equipment that allows you to measure what coverage areas are, and that helps you decide where you put your access points. So on the left side, by putting these 5 sort of Wi-Fi routers in the hallways, you can see on the right side, all of these apartments get adequate reception. And so it's an efficient, fast way to go about this. Next slide, please. Okay, moving on. Our third project is with a community development corporation. It has about 2,000 units in the area. This is in essentially like Roxbury, Jamaica Plain in Boston. We did a similar thing as we did the digital equity plan, but in this case for this community development corporation, this affordable housing. And so we researched and we saw, as you can see here, you can see through like census data, we can see this area specifically where they have their properties is in great need of increased broadband access and other digital equity aspects. And so we did a survey and we confirmed that. Thank you. Yes, please go on next. And so Urban Edge is the name of this group, and they actually, side note, have a really interesting program with a group called Tech Goes Home, which is across the state, and it's a great group to know who do digital literacy training. And Urban Edge did one that's intergenerational. So they have older adults, they receive tablets and they get training, but then they've employed younger people, community members, to be sort of the support system around those older adults. And that it's a great model that you all should hear about. But let's say you want to make a community broadband network, as we did here in Brooklyn and we are going to do in Roxbury. You can think about this in a very interesting way, because it's not just about the buildings and the access points, but it's about all of the opportunities that exist to make this. So there are the digital aspects and the physical aspects, but then you think about the organizational assets that you have, like the staff and the resources that already exist at these community development corporations, affordable housing developers, and then the social assets, which are the residents themselves and their own social networks and their community groups and the community organizations that work out. And all of a sudden, you're not only thinking about the technical aspects of putting in a broadband network, but you're thinking about the social aspects of it. So next slide, please. You can see on the left side what we did. We identified these are the properties that are owned by Urban Edge and aligned partners. And we looked at all these properties and we see how dense it is, and we realized there's another way that you can deploy Wi-Fi, I should say broadband networks, getting people online. It doesn't have to be per apartment. You can actually bring it to a building and have it shared across the building, and then stepping out beyond that a little bit, you can also then share it from building to building. If you look on the right, generally what you would do, Verizon would bring internet to every single building. But what you can actually do is bring it to one building and then share it across the community. And I'm going to say one more time, that this idea of thinking about technology and internet access as a community effort is, it just gets me really excited because it brings so much more opportunity to the work besides helping people just turn on their computer, and shop on Amazon. Sorry, I'll stop editorializing. Next slide, please. Oh, that's the last one. So I guess that was actually a good way to stop, because that's the point here, is that really what we all should be doing, the groups that are here today and other groups who are thinking about community and supporting community members, is we can do that. We should put that framework on technology as well. Any questions today or later? My email is in the chat, and I really appreciate being here today and you giving me the time. Thank you.
Awesome. Thank you so much, Tony. So as you can see, when I have actual technical questions about any of the stuff, well, I can talk about the advocacy and I could talk about the concepts. Tony's one person I go to when I actually have technical questions, as him and MAPC are doing amazing work to connect different parts of the community and look at this in a more holistic way, which we very much appreciate and we try to support whenever possible. And so we wanted to talk about our next community partner. So Cynthia Wilkerson, if you're out there and you can unmute and you can introduce yourself and talk about your amazing organization and program.
Thanks, James. Thanks so much for inviting me to be part of this conversation, and thanks everyone for your time today. LBFE, Little Brothers Friends of the Elderly, is an international organization, and the
Just lost Cynthia's audio. Was that just me?
tech conversations were a natural. Sorry about that. Am I back?
Now you're back. Yep.
Sorry about that. Anyway, we've been doing tech access work since about 2015 as part of our intergenerational engagement. In March of 2020, when all of our programming needed to move online, what we found is that there were definitely gaps in who could and couldn't follow us into the virtual space. And so that is where our new pilot program called Digital Dividends originated. So Digital Dividends launched in 2021 as a response to the pandemic and the shift to virtual programs. And it was, we work primarily with people in public and affordable housing, and then folks who are members of senior centers. Folks in affordable housing and senior center members, we were able to work with them to join us online. Our program participants who were in public housing did not follow us as readily, and for reasons around access and equity, some of the issues that James and Tony have already mentioned. We saw that as a real gap and also an opportunity to do some equity work and to work on bridging the digital divide in Boston. So some of the barriers, as we've already talked about, access to a device with the teleconferencing capacity, internet access, tech literacy. And then for us, because we work with so many immigrant communities, there's also an issue of training that is linguistically and culturally accessible. Next slide, please. So our Digital Dividends program offers program participants a Chromebook. We provide a internet access via hotspot, and that's available to participants through the duration of the program. We also use an intergenerational model for our training and support, and those sessions are weekly. And it's also our mission is to address social isolation and loneliness among older adults, And so in all of our work in community spaces, we are trying to build both intergenerational connections, but also peer-to-peer connections so that that folks are always building and maintaining their social networks. And so that's another component of the work that we're doing is giving neighbors a chance to spend time together and get to know each other a little bit. And then we also provide linguistically and culturally informed training. Next slide, please. So we're in the midst of our pilot year with digital dividends. We've had about 60 participants in 4 buildings in 4 different Boston neighborhoods. We had, from our fall session to our spring session, we had about 85% of participants return. So it's a meaningful retention rate. We work with the Public Evaluation Lab at Northeastern, and so we have done some surveys and focus groups. We don't have all of our data analysis yet, but anecdotally, we have heard from participants that they feel both that their tech literacy and their comfort with technology has increased during the course of this initial training. And most program participants are saying, yes, we will be back for the summer session. One realization, as I said, we distribute Chromebooks to all program participants. One size never fits all. And we found that as I was saying, one size never fits all, and we found that for some character sets, for us Chinese, I think it would be true for other character sets, Chromebooks are not as easily adaptable as we had hoped. So we'll continue to use Chromebooks, but for some communities, they may not be as easily integrated into the needs of the community as some other device. And then some other findings for us as we're completing our pilot. Trainings are most successful when there is a high younger to older participant ratio. So we're, as I said, it's an intergenerational model. We work with college students, and generally when there is more of an opportunity for some more one-on-one tutoring, that tends to be very successful, and because folks have different levels of knowledge and comfort, it kind of helps move the whole class along to have more opportunity for one-on-one support. Because of the range of skill and knowledge, we're finding that grouping participants into user groups can also help move the training along. And with adult learners, continuity is essential. And we've also found that certificates of completion are really warmly welcomed. I have been struck over and over again by how delighted people seem to be getting a certificate, getting the acknowledgement of their what they've accomplished. And you know, we see folks who I don't know if they've ever sat in front of a typewriter. I don't know if they've ever sat down in front of a keyboard before. They're really opening themselves up to a new experience, and it's I think it just speaks to the absolute need, interest, and commitment of people, of older adults we're working with, to learn technology. There is an absolute appetite, there's commitment, there's an enthusiasm, and there's a willingness to show up week after week and learn together. So thank you.
All right, thank you, Cynthia, very much for that. So through Tony and Cynthia, I wanted to bring in some great partners that we're working with again to talk about what's actually happening. It's one thing to talk about an approach to advocacy or an approach to digital equity in older adults as a social determinant or a cross-cutting social determinant, but to actually see it happening in communities with a focus on senior housing and an intergenerational approach and social connection, you really start to see the value of how these dots get connected and how partnerships really matter for getting the work done. So thank you, Tony and Cynthia, again. Thank you, Karan, and we can take any questions if there's time or be part of the discussion.
Yes, thank you all. I was I was trying not to get a little too reactive on the screen. I didn't want to distract anybody, but I have a background working in affordable housing, so hearing about these connections it was really amazing. And I'm going to Tony, I'm going to start saying digital equity in that three-legged stool. I vigorously took notes on that, so thank you for sharing that. But opening up, we have a few minutes. Anyone have any questions for our presenters, any of our presenters?
This is Judy Schley. I have a question to the team. This is phenomenal work. I wonder if when people are planning to create senior housing, that this is a component that's built into the planning aspects of senior housing. So you don't have to retrofit it, but it's a part of the progressive approach. It was just something when I was taken to what you're saying, you're retroing, and Tony in particular, I saw you're putting things in and stuff like that. Could this be done as part of planning for the future all over the country?
It absolutely should be. Yeah. It's much more difficult to retrofit a building to bring a network into it as it is to integrate it. And many groups are doing that now. And it also, in other places, in other countries, they have open access networks, which means the network is built and then any ISP can provide the service, internet service provider can provide the service. And because all of a sudden there's competition and there's no investment by the service provider to build the infrastructure, all of a sudden the prices go down and the service is improved and everybody benefits. So the idea of building those networks into a apartment building or senior housing or older adult housing, it's a microcosm of that same idea. All of a sudden you've made the delivery much easier and therefore should drive down prices.
Yeah, and Tony mentioned before the Mass Broadband Institute. So that organization started to help bring broadband access to communities in Massachusetts that did not have that connection. And I know people don't always think of Massachusetts as a state with rural communities, but there are communities that very much do not have connections to the internet. And so one thing that we're trying to do, and we've been trying to do, is as those land line connections get built, we're trying to advocate for and include councils on aging and senior housing as sort of anchor sites where those connections get made. I'm not going to get into middle mile, last mile, and all that kind of thing, but the connections to where people actually live and use the internet. We've been trying to get, when those connections get made to a rural or relatively isolated community, that housing is a part of that. And it has happened in a couple communities so far. So we'll continue to do that as well.
Thank you. Viviana, your hand.
Thank you so much. Viviana Criado from Los Angeles Department of Public Health, Los Angeles Alliance for Community Health and Aging. I appreciate the presentation, your thoughts on the amazing work that you guys are doing, and plan to call on you for support. We're doing advocacy at the local level. Los Angeles is in the process in developing a whole plan for inclusion. As with some of your experiences, older adults have not been called out, definitely as a priority population. So there is some advocacy around that. My question is about what are you doing about addressing cultural, language, and disability needs? Thank you.
So Tony can answer that for the MAPC region and the work you're doing in housing. So there's a couple things going on a federal level. The FCC has a call out for comment on digital discrimination. And we're trying to include age as part of that, but certainly they have race and ethnicity as top of mind already. That's already in the language right now. And I know that Mass Broadband Institute is going to have a statewide digital equity plan and we have lots of partners that are looking at rural communities, cities, kind of communities of all shapes and sizes, and diverse communities, and just kind of across the board of what digital equity means in different parts of the state. So on a statewide level, we have some really great opportunities and partners that are really tuned into just listening and taking feedback and turning that feedback into an action plan that we can make something of. So on a through infusing this with the age-friendly movement and with encouraging equity in the age-friendly movement, that's kind of what we're doing on that end. And Tony, I don't know if you have anything else you want to add, or Cynthia, for your projects as well.
I wish I could tell you more active projects about that, but it's a great question, because that is a large component of the digital literacy challenge, because most of the programs or anything that is available that's written is written in English for the great majority. And then also the technical communication is challenging also to translate. So I would echo what James is saying too, which is, in the next coming months, probably in the next 3 months, in the summer, fall, there's going to be a digital equity fund that's going to come out from the Massachusetts Broadband Institute that's going to ask for ideas and comments. And I think that we should all make that a high priority, which is digital literacy programming in community languages.
And even the ACP, Affordable Connectivity Program, I mean, those applications are available in English and Spanish, and I don't know if they're available in any other language right now, but we have partners trying to translate those applications into even more languages so that we can get more people signed up and bring them to a wider audience. So that's another thing that's happening in some parts of the state as well. But Cynthia, you want to go ahead?
Yeah, I'll just say that it's a priority for us. At one of our digital dividend sites, we had students who spoke 3 different Chinese dialects along with English speakers, all in the same room together learning. It's challenging, but if that's that at the community level, it can be done because that's the makeup of the buildings we're in. They're multilingual, they're multicultural. Those are the communities. And so if we're serving the community, that's it. That's what it looks like. It looks like a lot of different kinds of people. And it's a great opportunity to bring people together and forge new community partnerships to support that kind of asset-based approach to this essential service.
I would like to add, just as a point for the advocacy effort, the fact that the great majority of older adults that have been left behind are individuals from diverse communities, are monolingual Spanish or monolingual other language speaking. So the effort, I think we can wait until the issue of equity is brought up, or we can start looking at expecting that the services and resources that will become available actually address this issue for older adults. And let's make it a 4-legged bench. This is the piece that we need to be looking at. Thank you.
Thank you, Viviana, for that insight. Mary, if you have a quick question, we can let you.
Yes, I just want to say that when we did the Harvard sprint, what we learned is that we need to work with the community. We need to have things to give into the community rather than say, can you take this that we developed and translate it allow the community to develop the materials in language that makes sense to them, and they will vet it with the community rather than saying, we have this 2-pager, now go forth and translate. Thank you.
Mhm. Mary, you're speaking my language. I have, again, background in community work, and I could not agree more. So thank you for sharing. Thank you all for your great questions. We love questions. I apologize, we're a little over the hour, but I really do appreciate all the insight. Thank you so much, James, Tony, and Cynthia. I thoroughly enjoyed this. I definitely will be in touch because I have some follow-up questions on my own. James and Tony, I think, and I don't know if Cynthia did, but they all have shared their contact information in the chat. And before we close out, very quickly, everyone, tune in next month. We're going to focus on nutrition and food security. And that training again will be on June 15th, not June 16th. We had to switch to a Wednesday. I know that is not our norm, but we will switch to Wednesday. Again, this will all be made announced through our newsletter and other channels. And that information will be under our events section on the AFPHS website very soon. So that's AFPHS.org. And if you are viewing this training after the live session, please look at the top right corner. You will see a link to complete a completion of the training survey, or you can hit pause right now and follow and navigate to the following URL to complete the post training survey. And with that, I want to thank everyone for attending today. We certainly appreciate your time. Have a wonderful afternoon.